Technology is so important part of our daily lives. When we pick up our phones, especially those smartphones or those tablets, we notice how your posture will change. There's something called tech neck. Well, today we're going to be meeting with Dr. Amber Voitenko of Voitenko Wellness in Tustin, California. She has a lot of great ideas how you can correct this and how technology affects our skeletal system. Let's go meet with Dr. Amber.
Hi.
Hey, Dr. Amber.
Welcome to Voitenko Wellness. So good to see you.
I'm very glad to be here at Voitenko Wellness. How are you?
I'm doing great. How are you doing?
I'm doing great. I'm
Awesome.
looking forward to talking with you today and find out what's going on in your practice here.
So exciting. Thank you.
Dr. Amber, welcome back to Insights with Entrepreneurs.
Thanks for having me.
I'm so happy to have you back. I have so many viewers that have been asking where you've been.
Yeah, great. Thanks for having me back. I appreciate it.
Dr. Amber, just really quick, Dr. Amber has been in chiropractic for over 20 years now. Hard
Almost
to
25.
believe. 25 is so hard
Yes.
to believe. Yeah. She's been in her own practice for almost 20 years here in Tustin. And over the last 10 years, I've known you for about 10 years now. And I've watched your practice grow.
Yes, indeed.
Yeah. So Dr. Amber got into chiropractic due to an injury that you had.
Yes.
Long ago.
Yeah. When I was a teenager, I was in a bad accident, as you know, and I injured and fractured my neck. So a chiropractor actually educated me on what they do and how they could help. And in just a short few visits, I had relief. And I thought, oh my gosh, this is like such an amazing, human body mechanic type treatment to help one get out of pain. Yeah, it was awesome.
But one of the things we're going to talk about today is, and you just mentioned it, is injury to the neck due to technology.
Yes.
And we forget that with technology being so part of our lives,
Right.
that it's affecting our skeletal system.
Exactly.
And I think which is subliminal for me. In the middle of the night, I woke up, I have a pain in the neck, a true pain in the neck. Okay.
I'll fix you. Yes.
You'll fix me. I know you'll fix me before I leave here. But it was like, oh my God, I can't believe this is happening. This is happening. Because I'm going to talk about, what is it called?
Tech neck.
Tech neck, which is the terminology that's used for your neck. But when you think about how you hold your cell phone,
Right.
okay? And your whole body changes. So if
Correct.
you pick up your cell phone, you're going to see that your body's going to change the way it is.
Yeah.
Or your tablets.
Right.
Or we spend so much time at work, working with computers, and it affects our posture.
Completely.
And we don't think about how it's going to affect our posture.
Correct. Yes.
Well, one of the things I found really interesting in preparing for this, and I know we've talked about this in the past, if you go back to 1931,
Right.
you find that the comic Dick Tracy,
Yeah.
what is he doing? In 1931, when his comic strip came out,
Right.
he's talking into his watch.
Yeah, that's awesome.
Okay.
Even back then.
All right, and then if you go into the 1960s, you have, what was it called, Get Smart?
Right.
With Maxwell Smart.
Yes.
Talking into his shoe.
Yes, that's right.
And then, of course, that's the same time when, if you're a Trekkie,
Yeah.
when Star Trek came out,
Right.
that, they had their recorders and they were beaming up all over. We're not beaming all over the place
Not yet.
Mess with the whole system, the body system. But we've been fascinated since the 1930s with some form of computer.
Right. Technology. Yeah.
Technology.
Really cool.
So what is all this technology doing to our posture.
Yeah.
I mean, I see you've got your little
yes.
guy here.
So one of the things, like if you ever pay attention, even when you go to a doctor's office, but if you, like here in our office, we'll watch patients come in and their kids and themselves get on their phones and their chairs. And instantly what happens is they're not holding their phone up here. You know, they're going down like this. And some of them, it's like they have to look really close because of eyesight. And so what that does over time, it, you know, affects your posture. Heads are heavy. They're like bowling balls. And so when you have this type of situation, because we live in gravity, right? Physics, the weight of the head alone compresses the discs in the neck, the upper back, and that's detrimental because your nervous system, your spinal cord is in that area. So basically, I mean, just to kind of give you an idea, this should be a curve here, right? So when somebody's head is forward, you know, they're really causing a lot of forward head carriage, which again affects those discs and the nerves and spinal cord. And the neck controls everything, you know, your eyesight, hearing, tasting, smelling. The lower neck is your digestive tract, your lungs. Of course, also affecting how we, because of the lungs, how we breathe. And so when people aren't realizing what they're doing and they're in this kind of like going back in fetal position, they need to, you know, make sure that they're pulling their shoulders back and helping, because otherwise, eventually over years, but you know, when you're on technology, you're not thinking about it over years, you'll get that degeneration.
I know it's really hard. You think about that your head weighs 10 pounds or 11 pounds.
Right.
Depending upon the size of your body.
Correct.
And then all of this is supporting
that.
Like what you said, a bowling ball.
Right.
Okay.
Yeah, for sure.
So what would you recommend? Okay. So when you're sitting here like this, okay.
Looking at your
pretending this is my.
Yeah.
Yeah. So when you're sitting here like this, and I notice that my head is going like this, okay.
Yeah. Truthfully, the real thing on it is not being on your cell phone as much, like having less screen time. But, you know, if you really want to, you know, get yourself to be in a specific habit, is holding your phone up in front of you. Of course, your arms are going to get tired and people are going to drop down no matter what. They do have some contraptions, you know, that you can use to hold your phone. There's this interesting little silly thing that kind of wraps around the back of you with a foam piece and then comes out in front and hold your phone. It's not strong enough for like an iPad, but it'll work for the phone. So, you know, when you're in, not necessarily in public, but maybe when you're at home, you know, using it so that you're helping your posture. It is that important though. Again, just to reiterate, if you don't do things like that and you are doing a lot of screen time, especially on a cell phone, you know, eventually you're going to have osteoarthritis, which is a mechanical type of arthritis. You're going to have some sort of neck pain, stiffness, tension, tightness. Those are like the first signs. And then eventually it'll affect, you know, some people come in and they have vertigo, they have different types of headaches, they have problems breathing, they have problems with their blood pressure, not just, you'd think, not just high blood pressure, but even low blood pressure where they're passing out and fainting. And it's because of that compression on their lower neck and upper back due to postural problems. So it leads to major issues, you know, with your function.
Well, I know. Anytime you walk into a doctor's office, the first thing they do is they take the blood pressure machine.
Right.
Okay?
Yep.
But if you're in pain, the blood pressure goes up.
Right. Exactly. And just to think, your neck controls as part of that computer that controls your blood pressure. So if you've got a lot of stress and strain due to postural problems and now arthritis is set in, it's difficult to get out of those medical situations.
Well, I know the body itself wasn't made for all this technology.
Correct, right. We're made to be upright, lifting, not really in this, you know, going back in this fetal position. And same thing goes for the laptops, the desktops, you know, things that we suggest here at Voitenko Wellness is, you know, getting standing desks or desks that you can sit and stand to change your posture. The other thing that we suggest too is that you take breaks. You know, people get really focused into their work on their computers, doing something for hours and hours, that you want to make sure that you actually get up every 2.5 hours and stretch and walk around so that your spine and your nervous system and muscles can relax, and your eyes and your hands.
I mean, it's just so much is affected by this technology that has overtaken our lives.
That's right.
I mean, we can't live without it.
Right.
I mean,
it's a part of our lives now for sure. Yeah.
Yeah. I see small children they're always playing, and you see them all scrunched up.
Right, in their forward head carriage, and they're bent over. And that's why, the whole thing with screen time, on phones and even on laptops and stuff, that you actually can control that screen time. Like, you can have parental, there's guidelines where they can actually go on and stop their child from being able to look at the iPad or their phone.
But is there an exercise that they can do afterwards, that they're stretching the muscles and they're stretching?
Yeah, one thing there's even like young, like 2-year-olds, 3-year-olds. Making sure, those are the other types of things that you can get where they have, something to put the iPad on or a phone, so that at least it's in front of them when they're sitting at like a table or a desk. The problem is when they're on their couch or their bed, there really isn't much. They have really neat like lap pillows and things that you can get that have angles that will help. But again, it's all about how they're sitting, and teaching a young person that early is obviously very important if you can, accomplish that feat.
Well, I'm sitting there and I'm thinking of my 5-year-old grandson.
Totally.
And I see his legs up, and he's all scrunched in, and
he's
intensely into his game.
Yeah, not even focused on posture or where he probably even is in space. He's sitting there focused. Yeah.
Right. So I'm going to go to the other age group, like the senior citizen, where we're at right now. We have other things. We see the degeneration from
other repetitive motions or traumas. I was going to bring that up. It depends on what someone's been through in their life as far as what phase degeneration and, what's happening with the arthritis, would you like me to show the different phases?
I would love to see that.
So basically, just get this up here.
Let's see. Let's turn it around.
Yeah. So basically what this is, it's a model that shows, a healthy spine. This is the lumbar spine. So a healthy spine versus phase 1, 2, and 3. And there's 3 different phases of osteoarthritis. So we're talking specifically of osteoarthritis, which is a mechanical problem. Your body naturally tries to protect itself when you've had traumas, injuries. So by doing so, sadly, after compression, misalignment, it can cause bone to form, which then causes the discs that are in between the vertebra to not get the nutrition it should. So you can see how healthy these discs are, and then it starts to compress. And then here you see the disc starting to die, and here there's disc death and nerve death. So when we get older, the reason why some people, we see this more is due to the fact that there has been repetitive motions like we're talking about, right? But it could be from cleaning, it could be from, housekeeping. It could have been that person had car accidents, like a female, maybe having children because they're always lifting and pulling, plus, having the baby in the womb. It's kind of that fetal position, your round over forward head carriage. Anyway, that being said, all those different things over a lifetime, it can take anywhere between, let's say 10 to 20 years to get osteoarthritis. But the more important aspect of this is what we're talking about with technology. When somebody's had these other things happen due to sports or repetitive motion, and now you're on a computer, you're on your phone, or you travel a lot. There's a lot of people who travel. It causes this situation to become worse. So to answer your question, because you're like, what do we do about this, right?
Right. There's so much. Just even holding the phone can change how your hands are shaped.
People come into our clinic with numbness, tingling, weakness in their hands and extremities. And though it can be due to their phone or computer work, when we look to the neck, a lot of times we'll find that they have degeneration going on. And that's what chiropractic is for, to stop and slow that condition. If you catch it in time, you can completely prevent it. But most of the time, what drives someone into a doctor's office is pain or symptoms. So sadly, when that occurs, that's a warning sign if it just happened. But a lot of times when we take x-ray and do the thorough exam, we'll actually see, oh my gosh, already there's degeneration or something going on that way that we have to actually stop and slow. To answer that question though, about what can you do to change your posture, chiropractic's amazing. Getting to a chiropractor that actually does x-ray, because there's different units that you can use, tools at home for home care that can change this situation. So tech neck can be, reversed and changed if caught soon enough, and even the effects of it, depending on when you get to the chiropractor.
Right. I mean, but it's how to prevent it before you
Correct.
get to that point.
Such the key point, right?
Yeah.
So pain is usually what drives someone in. My suggestion always when we have families come in, it doesn't really matter if they're a grandparent or a parent.
Right.
We're telling them you should tell your family and friends before it's too late to get a postural check from a chiropractor, right? To evaluate alignment and what's happening with the curvatures of their spine, and then even their daily activities, such as being on a phone or a computer, right? So you can help them not lead to this, because this is bad.
I know nowadays you have the Bluetooth technology, so you don't even have to pick up the phone.
That's true. You can do different things this way. I think what it comes down to, though, is the visual aspect and the part where you're constantly, like people who are on computers and such. I mean, Bluetooth can help to a certain extent, but you're still going to be at that technology. You're going to be at your environment, your daily activities. So
I know there's different types of stands that you can put the phone on.
You can. And also for those that have desktops or, the laptops, you want to actually be able to utilize them posturally. So there's different, we call it ergonomics, like even if you're working from home or your workspace, where you have the right amount of distance, your keyboard is set up properly, that eye to computer distance is proper. You want to have all those steps in order to prevent having neurological damage and postural damage. Otherwise, it's going to lead to all those symptoms we were talking about, right?
Yeah. Pain.
So, pain.
And I can feel it right now.
Exactly.
And I'm a big gamer, so I get on the...
Oh, you are?
Yeah,
major. That's awesome.
I get on there and I play my games.
Yes.
And I'm getting competitive.
Sure.
So you spend too much time being
you forget
competitive.
how long you've been on that screen time.
Yeah.
That's
so
funny.
This person's getting ahead of me. I got to get up there.
Right, exactly.
But it's really bad for the neck.
Right.
And
where
for
you're
the
sitting.
spine.
Right, exactly. Neurologically, it's difficult on the body over time. Right. And like you're talking about, it can lead, like if you really get into something and you're on your phone for hours, it can lead to stiffness, tightness, decreased range of motion. Sadly, though, over time, if you don't get adjusted, you don't get aligned like chiropractically, and you don't get, your musculoskeletal system worked on, then it leads into all these symptoms like we're talking about: numbness, tingling, weakness.
Oh, definitely.
Right.
I even feel like my thumbs, my fingertips are going numb because of all the crazy game playing.
And that's posture. That's, all the nerves in your neck and upper back is what controls your shoulders, elbows, wrists, hands, and the function of it. So it makes sense.
So it's like...
You got to take more breaks.
I mean, it was like yesterday, and I'm going, it's so appropriate for this show.
Right.
I'm going, this is not important. I should be doing something else. I'm feeling it in my body.
Right, exactly.
And my body is telling me, stop.
It's yelling at you, right, yeah. You've had enough gaming for the day.
Yeah, I've had enough gaming for the week.
For the week, right?
For the month.
That's right, yeah. No, we, there's many times where patients come in, whether it's due to computer or phones or sleeping. They're like, literally, I slept wrong and woke up with this. But, everything is kind of this thing of like, it gradually gets to someone, and at first you might not notice the symptoms being that bad, or, you might think, oh, it's going to work itself out. But over years, right, when people are on this kind of technology, it affects them. And this is what causes, one of the things that cause the osteoarthritis. So,
right.
Yeah, like doing something prior is much better than waiting till you have a major problem.
So our bodies and the technology, we're going to have to learn to work with it so it doesn't affect us.
You're right. You just really have to, what's the right word? You have to make sure that for your body, you're giving yourself downtime from doing those things. And if your job, a lot of our patients, their job entails them to be, in front of a computer doing work with technology. And so they have to take the time to actually do other things, like you were talking about, stretches, chiropractic, doing home care so that they can help prevent osteoarthritis and degenerative disc disease and neurological dysfunction. I mean, it's a problem.
It is a problem. I think it's going to become a very challenging problem as we find that our bodies can't tolerate it.
Right. And it's like, definitely in the last 2 decades, you've seen that problem get worse. And those are the types of conversations you have to have with patients. So
you slightly mentioned earlier that it can affect your breathing.
Yes, that's a really big one. Breathing and blood pressure is one that people wouldn't actually really think about because they're thinking more of neck pain, neck stiffness, tightness. But your lower neck and upper back control huge part of your cardiovascular system and your breathing. So super key. And stretching and getting chiropractic really helps open up your pecs and relaxes your shoulders and can help with your forward head carriage. A lot of times though, if somebody's gotten too far forward with that, meaning that they have degeneration, really bad posture, they need home care. They need almost like getting physical therapy, right? They need to do something to help pull their forward head carriage back and create a curvature in their neck. And that will relieve that pressure on the spinal cord and nervous system to help with that problem.
But it is on the breathing part of it, it's your lungs that are being affected.
Right.
Because you're now this.
Like when you're hanging over like that and you try to take a deep breath in, it's super difficult to get that deep breath. So by just even standing more upright, bringing your shoulders back and your head back, taking that deep breath in and out, you can breathe better than if you're hunched over. So even that, like you were asking, well, what steps can someone take? And really those breaks are about making sure that, you're stretching out your pecs, you're taking deep breaths in and out. You're really focused on what your body posture is when you're not at your computer or you're not gaming on your phone.
Well, it's gaming on those iPads.
Oh, or on your iPad,
I mean, I play a lot of Sudoku on the
Oh, that's cool. On the iPad,
phone.
yeah. I mean, some suggestions that I always have, especially for the, seniors, right? And I say seniors 55 and older because I can say that now.
Yeah.
That being said, making sure that if you're on your iPad or you're on a phone or even a laptop, that you have different things where it's setting up in front of you so you're not constantly in that flexion forward head carriage motion. So being at a kitchen table or a bar is actually better than sitting in your recliner or a couch or your bed.
It's interesting because I have found that I'm doing a lot of walking.
Right.
Okay.
That's great for you.
And I love it when somebody calls me, but then now I'm on the phone.
Right.
So even though I'm walking, which is good for me, I'm still I've got the phone out.
Right. You're still doing something.
I'm still doing something that's not good at the same time.
I know.
Even though
they're kind of addicting. You know, they really are. It's like that. And I think that's it, getting the discipline in to make sure that, you're having your own time walking or, or even with the kiddos, making sure that they're not on the screen too long during the day. So posturally, like they go outside and play. They do other things with their, human body mechanics to get them moving and outside, because that's really key, because it does affect you neurologically in other ways besides even what we're talking about because of the effect of the spinal cord and nerves. So behavioral and all that.
Well, that's great information that we have here.
Yes.
Thank you very much for being on Insights with Entrepreneurs.
Thank you for having me. I appreciate you.
Oh,
everyone
well,
listening.
Thank you.
Yes.
Love to have you back sometime in the future.
I would love that.
You always have good information, and as I said, I've always gotten good feedback from you being on our show.
Wonderful.
So, okay. Everyone, if you have any comments to make, please make comments. Both Amber and I love comments.
Yep.
We would love to respond back.
Yes.
You definitely will know how to get a hold of us. Thank you.
Bye.
Bye.